Hello! I wonder if you found this video because you've been looking for ways in which to improve your fertility. Or maybe your fertility clinic has recommended that you look into acupuncture as a way of helping you through your treatment. Maybe a friend or relative has recommended it to you and you started to look into it and wondering, is it actually helpful or not? So today I want to try and calmly explain to you what traditional Chinese medicine is and how acupuncture can help support your fertility, whether you're trying naturally or going through assisted fertility techniques. I'm going to explain to you what it is and also what it isn't. I'm Gabby and I've been working as a traditional Chinese medicine acupuncturist for about 17 years now. And like many people who work in this world, my own personal fertility struggles is what led me here. I had 3 miscarriages, unfortunately 2 happy pregnancies. So after that time, I decided to retrain, left my corporate career and decided to set up my own business helping other women to get pregnant. I'm going to go through what TCM actually is, how it works, and the type of person who would find treatments beneficial. And if you stick around to the end of the video, I'll tell you about a freebie I've made just for you too. Now, as I go through, if you have any questions, please just pop it in the comments below. I promise I'll reply to every single one of them. Don't worry if you think it's a silly or maybe a complicated question. The topic of fertility is complicated, and I'm sure that if you ask the question, somebody else will benefit from that too. So let's start with what traditional Chinese medicine actually is. Well, TCM is a medical system that's been around for about 2,000 years, and it includes acupuncture, herbal medicine, and tuina. It looks at the balance of yin and yang of all the organs of the body and the flow of qi and blood. Although the organs of the body have names that we recognise from Western medicine, like the lungs, the heart, the spleen, we aren't actually referring to those specific organs. It's like a collection of jobs that group together, and we call them the kidneys, which incidentally are the organs responsible for fertility. Now, each organ needs a balance of yin and yang to complete their set of jobs. So a TCM practitioner like myself, we first start by understanding if there is an imbalance somewhere in the patient's body, by understanding the symptoms that they have. For each organ of the body, there is a corresponding meridian. These can be thought of as a river of energy that flows through the body, and it usually starts at a finger or a toe and then runs through the body towards the relevant organ. And along the meridian are certain points which, when stimulated either with a needle or with pressure, can influence the flow of qi to the organ in a particular way. Say, for example, I'm treating a patient who is always cold. Actually, this is about 99% of the women I treat for fertility in my clinic. They're cold all of the time. And after a consultation of symptoms like what I can see and tongue diagnosis and what they're telling me, I may come to the conclusion that she is kidney yang deficient. So I'll choose a point on her kidney meridian which can help with this and help restore that balance, therefore improving her kidney health, which will also improve her fertility. Now, I know this sounds strange because a Western doctor doesn't usually ask you if you feel hot or cold, but a TCM practitioner is really interested in that. Symptoms can be either physical or emotional, and each acupuncture point can influence that. For a lot of women trying to get pregnant, the emotion of frustration is super common, and we can choose a selection of acupuncture points which will help smooth that emotion over. We focus on regulation and balance, both physically and emotionally. Each person I see is totally unique. So every time I see that person, I'll also review how they're feeling, what their symptoms are, so we can tailor, tweak and adjust the combination of acupuncture points to get the best effect. And I look at points which help relieve the immediate symptoms and points which help the underlying health of somebody. And what I'm trying to do is create a harmonious position where a person is physically receptive to a pregnancy and emotionally balanced, trying to smooth out the journey so that you don't get fatigued by what is a roller coaster of ups and downs every 2 weeks. Now, fertility is still quite a secret subject, and sometimes it's hard to get this message to women who are struggling alone in the darkness. I know how that feels. Just by clicking the like button on this video can help YouTube put this video in front of other people who might find it helpful. So if you've liked what you've heard so far, just please click that like button. And also, I post videos every week on fertility, so you can subscribe to the channel and you won't have to keep scrolling through YouTube trying to find something that's relevant to you. So when I first heard about acupuncture almost 18 years ago, it was because somebody had recommended it to me to help with my miscarriages. And I just thought, what a load of nonsense. How on earth can some tiny pins make a difference? I liked science-based, research-backed data, and for me this just sounded a little bit too woo, if you like. So if this sounds like you, well done for getting this far through the video. So let me just share with you some science-based data about acupuncture and fertility. So a few years ago, there was a well-known study published in the journal called Fertility and Sterility that found that women undergoing IVF who had acupuncture around embryo transfer had significantly higher pregnancy rates than those who didn't. What's important really isn't just the outcome, it's why. The acupuncture group showed that they had better uterine blood flow and lower stress responses, both of which we think directly affects implantation. So when we talk about acupuncture helping fertility, we're not just talking about energy in a vague sense. We're talking about circulation, calming and balancing the nervous system, and creating the right environment for implantation to happen. So that study is often credited to Paulus et al. And it's frequently cited because it was one of the first studies to bring acupuncture into the mainstream fertility research environment. And in fact, we still use the Paulus protocol for treatments just before and just after embryo transfer. So shall we talk about what TCM and acupuncture isn't? Well, in my opinion, it's definitely not a replacement for Western medical care. There are limitations to what we can do in the time domain that most women would like to work with. For example, the theory of TCM suggests that we can resolve the damp or mucus from blocked fallopian tubes, but this could take many months of treatments. So in my opinion, this should be looked at by a Western medical professional. And the beauty of acupuncture is that you can have it alongside Western treatment. There's no conflict. So sadly, there is no guarantee of a pregnancy with acupuncture. I've treated hundreds and hundreds of women over the years, and I can only think of a few, like a handful, that haven't been successful in achieving a baby at the end of their journey. And sometimes there's been many twists and turns along that path and the way to get there. But anybody who's guaranteeing you success, 100%, in my opinion, should be avoided. Acupuncture is something that can help you along your journey to becoming a parent, just as Western medical approaches are. But there are no guarantees, I'm afraid. So acupuncture is not painful, but confession time, I am actually a needle phobic. And when I was training, I had to practice needling myself at home just so that when we were practicing on each other in college, I wouldn't pass out when we were needling. So I totally know what it's like to be scared of these teeny tiny little needles, but I am super gentle and I use very small needles. It's not like going to a physio where they bring out big thick needles. And most women I treat know what it's like to pluck out an eyebrow and know what that feels like. Now, that is 100 times more painful than acupuncture, I promise you. And once the needles are in place, which is pretty quick, my patients are wrapped up nice and warm and left to relax, and most of them are fast asleep. So hopefully you're starting to think that maybe acupuncture can help you. In my clinic, I see women who have a wide range of backgrounds, from their late 20s to their late 40s, who are either trying naturally to get pregnant or who are going through IVF. Some have had miscarriages, some have never had a positive pregnancy test. And each case is totally unique, but they all share a common mindset of frustration, confusion, sadness, and not really knowing what to do differently in order to have a successful pregnancy. So alongside acupuncture treatments, I help them to understand their cycle, track their ovulation accurately, learn which supplements would help them and which they don't need, how their lifestyle can influence their health, what foods can benefit their TCM diagnosis, and ways in which to manage their stress levels. It's not just, hello, let's stick some pins in. Quite often, I'm the only person they are talking to about their fertility struggles, and I can really help bring them clarity and calmness throughout that journey. So I did promise at the start of this video that I would give you something as a little thank you for watching. If you head to the pinned comments below, you will find I've put a free PDF download in there for you, and that will help just if you need a calm reset today. Without a doubt, trying to keep a handle on your mental well-being when you are trying to get pregnant is one of the hardest parts of infertility. So I do hope my download will help you a little bit. And don't forget to like this video if you did. And if you want to share it with somebody else who you might think is struggling with their fertility as well, I'm sure they'd appreciate it. And if you have any questions, just pop them below and I promise I will get back to you. And I'm wishing you lots of luck on your fertility journey.